That's because one of the real options for men with lower grade prostate cancer, lower risk prostate cancer, is to do what we call active surveillance, where we decide we're not going to treat the cancer early on or immediately. We're going to monitor you closely, and at some point, if the cancer tells us that it's behaving more aggressively than we might think, then we might decide to treat you. And the reason being for this is that we know that prostate cancer, even when it's more aggressive, in many cases is still very slowly growing. So we feel we have enough of a head start on it in those cases to watch it initially and then determine if ever you need treatment. Thankfully, what we found is that many men that go on active surveillance don't eventually need treatment at all. So if you go into it knowing that you're at a very low risk of progression, it may be a choice that you make to decide to do active surveillance. There really are no strict guidelines for active surveillance. In general, I think most of us believe that a repeat biopsy sometime in the first year is helpful. We've started to use MRI technology, which has really developed in the past few years and allow us to see cancer within the prostate to make sure there's no more significant cancer that, for whatever reason, was missed in the initial biopsy. So we often are using MRI as well, and even being able to pair the MRI with newer techniques in how to do the biopsy to get a really precise biopsy of those areas. We generally recommend getting a PSA at least a couple times a year, and those repeat biopsies every 1 to 2 years after the first year.